I, Blake Schroeder, will be your MC. I'm a clinical psychologist with the Road Home Program, Army veteran and officer in the Army National Guard. Joining me from the Road Home Program, we have Christopher Miller, Outreach Coordinator and Marine Corps veteran, who is running the technology for today's event. Patricia McDaniel, Clinical Social Worker and U.S. Army veteran, who will be monitoring the chat box throughout the webinar. A few housekeeping items before we get started. Please note this event is being recorded and will be made available to you and others later today. There'll be time for questions and answers at the end, so please hold your questions until then or enter them into the chat box as we go. We have over 100 individuals joining us from throughout the nation today. Again, welcome. This event will run from 12 to 2 p.m. Central Standard. Each set of speakers will present between 20 and 30 minutes. The remaining time will be dedicated to Q&A. The Road Home Program is a non-for-profit mental health clinic that specializes in the delivery of evidence-based mental health treatment to military veterans and their families. We have a 2-week intensive outpatient program located in Chicago at Rush that provides PTSD treatment for those who have combat-related or military sexual trauma. The program is open to any veteran, regardless if the veteran resides in the state of Illinois or discharge status. In addition, we have an outpatient program that focuses on delivering care to veterans and their family members. We have locations in Chicago and Effingham. Through the use of telehealth, we've expanded our reach and can now deliver care to any veteran in the state of Illinois, pending they have broadband access. All services are at no direct cost to the veteran or client. A warm welcome to our keynote speakers. Thank you so much for sharing your knowledge with us today. Presenter bios can be found in the Google Drive link that is located in the chat box. Michelle Huerta is a U.S. Army Medical Evaluation Board attorney, advisor, and veteran of the National Guard. Josh Layton, veteran service officer with the Illinois Department of Veteran Affairs and Marine Corps veteran and actively serving reservist. Jim Dolan, senior director of development with Illinois Joining Forces, trusted partner of the veteran community. And finally, Martin Parsons, attorney and clinical assistant professor with the Veterans Legal Assistance Program Clinic at SIU School of Law, Marine Corps and Army National Guard veteran. The intent for today's webinar is to provide information from a panel of experts in the field on the Department of Defense and Department of Veteran Affairs service-connected disability benefits process. The webinar will start with Michelle, who will review specific service-connected topics related to Department of Defense. Josh will then discuss how to initiate a VA disability benefits claim. Jim will discuss how Illinois Joining Forces can support a veteran during the application process. And finally, Martin will be reviewing how to navigate a VA appeal. We will end with the webinar with a Q&A. Without further ado, please welcome Michelle.
Hi, good afternoon, everyone. Let me see if I can share my screen. All right, so I'm going to just touch briefly on the actual DoD process, our integrated system that we use with the VA when a person is on active duty. Because for most veterans, you've gone past this point, but for the providers, I wanted to make sure that they understood what this process is like for us. All right, so let me say that I work for the U.S. Army. Any opinions that I offer today are my own, and I have limited knowledge of how it is for other services. So some of my terminology will be based specifically for the Army. But if you have questions or I can help you make that transition to the other branches, I'm certainly willing to do that. All right, so in the integrated disability evaluation system, the very first point that happens is a soldier or service member is referred to the process. At Fort Campbell, we consider that to be referring to the Medical Evaluation Board. To do that, the soldier or the service member has had to reach their medical retention determination point. Typically, this comes after 1 year of rehabilitation for their condition. So if somebody has a bad shoulder, they've been on profile for over a year, at that point, it'll be determined that they can no longer do their job with that condition, and they'll be referred to the Medical Evaluation Board. This also happens if someone is expected to have a condition that will not get better within the year. And so we see this often with catastrophic injuries that may happen, taking a rubber bullet to the face or to the eye socket might be an example. Once the referral is made and the medical evaluation board director has signed off, meaning that everything is there to substantiate that claim or that referral, the next step is the compensation and pension exam. This, for me, and when I give my advice to my soldiers, I always say this is the most important thing that happens to you in this process, because if you have a bad examination, the ratings that you receive in this process will also be equally bad. And of course, the Army or the service copies over the rating that the VA has given you, for example, on that shoulder. Good to know is that even if range of motion is not affected, you still can receive a rating for that condition. So if you have, if your hips hurt because you've been rocking around with, 65 pounds on your back, it's important that you make the claim for your hips and that the examiner does the DBQ or disability benefits questionnaire specific for the hip condition. Once that examination is complete, it then goes to the medical evaluation board, where you have a provider, an MEB provider, who is not a treatment provider, but is in fact a reviewer of your medical records and will also review that compensation and pension exam. They draft what is called a NARSM, or a narrative summary. This is really important, another really important document, because it is your story. And you'll see later on when we talk about the importance of your story, you need to make sure that you're getting the mechanism of injury or the causation of what happened included in that NARSM and that narrative summary. The medical evaluation board's process or their goal is really to see if somebody meets or fails retention. That is, and in the Army, that's the AR 40-501 Chapter 3. It's a relatively short chapter. But what you're looking to do is, this is the condition, does it meet or fail retention? And that is really the only decision that is made by the medical evaluation board. From that point, it then goes to the physical evaluation board, and these are in concentrated centers around the country. The Army has one in San Antonio, Texas, one at Fort Lewis, and then there's one in the National Capital Region. The physical evaluation board, their scope is much more broad. What they're looking at is whether or not a service member meets or fails fitness. So you can fail retention and yet still be found fit, just as you can meet retention and be found unfit. And one of my favorite examples for this is that I had a soldier who came through who had given up his right arm in Afghanistan. So he had lost his arm from the elbow after an extra surgery, but essentially had no arm at the elbow. Oops, sorry, something coming up there. And he came in and he said to me, obviously he's referred to the medical evaluation board, and he said, I'm not done. He was a new lieutenant, first lieutenant, real excited about his job. And he said, I'm not done. And while he was at Walter Reed, he had learned to shoot, learned to write with his left hand. And all I could think was, oh, shoot, definitely we're failing retention. We have no right hand. But we went to the physical evaluation board and we were able to make a fitness claim that he could still do his job as a platoon leader with just a left hand. Again, it was an amazing, amazing young man. But the physical evaluation board was able to see that, we did a video, we showed all these great things that this young man could do, and see that he was in fact still fit to be an infantry officer. So that's essentially what the medical evaluation board and the physical evaluation board do. Now, the physical evaluation board, well, let me not get ahead of myself. All right, so earlier I said the VA does the ratings, and if you have a poor exam, you'll have poor ratings. And again, why that matters is that the DoD is going to copy those ratings over to determine whether you or the service member is going to be medically separated or medically retired. So someone is either, if they're 0, 10, or 20%, they're considered a medical separation. If they're greater than 30, they are a medical retirement. A separation receives a severance essentially from the VA, and that is 2 times the base pay times the number of years of service, a minimum of 3 years, but a maximum of 19. The person would receive no other benefits. There's a couple of caveats, though, with this severance, and that is, it is not a severance like we think of in the civilian world, like here's a couple months' salary, thank you for helping us out, but we're done now. It is, in fact, a prepayment of the condition that got the person out of the military. So if their shoulder was a 20% injury, and that is the reason that they're leaving the service, the VA is not going to pay them for that 20% until it has been debited off from their total amount. So if you receive $12,000 as a severance, 20% is about $250 a month. So until that $12,000 is ate up by that $250, you won't see that 20% in your monthly benefit from the VA. So that's the caveat with severance and separation. Also know that severance is taxable, and again, there are some exceptions to that, which we'll talk about here shortly. If you're a medical retirement, the rating that is from the VA, and it can be a combination of different, so it could be your shoulder and say your right hip, got you to 30%, you're now medically retired. You will get the same benefits as a person who's a length of service retirement. That includes TRICARE for you and your family, including any future dependents, and something that is often overlooked, and that is state benefits. Each state is a little bit different, but they do offer some pretty significant benefits: property tax, wheel tax, those kind of things that veterans don't have to pay. All right. So one of the other things that Physical Evaluation Board does is that they assign V codes or Victor codes for combat or combat-related operations. And these can be assigned for anything that is as a result of armed conflict. It can be instrumentality of war. So think of things that are unique to the military: combat vehicles, weapons, Agent Orange. It can also be extra hazardous duty, and that could be flight, diving, airborne operations. It can also be conditions simulating war. So think about time spent either at the National Training Center or down in Louisiana at JRTC. It can be field exercises, and it can in fact just be at Fort Campbell, the back 40, you know, like where our local exercises take place. Interestingly enough, it can also be air assault PT. And so that's a pretty intense thing. There's a lot of rope training, and I've had a young person hurt their ankle as a result of air assault PT, and we were able to combat connect that. The benefit of combat connectedness is that when we go back to the severance, a person who has a V code is not going to pay back or be debited away that severance that was given to them. It is also going to make their severance non-taxable. So important when it comes to the medical separation. It's also important when it comes to the medical retirement, and that is because you can receive something called combat-related special pay or special compensation. And for those that are medically retired, the CRSC or CRISIC, sometimes it's called, is an extra check that comes from the DoD that is essentially saying, thank you, we understand that you got hurt in a combat-related situation, here's some extra cash. And it can be pretty significant. So again, that's one of the things that the Physical Evaluation Board does, and that is assigning a V code. The other thing that the Physical Evaluation Board does that is unique to the Physical Evaluation Board is that they can place somebody on what's called temporary disability retirement list. I like to think we call it a list, but it's not. It's really it's just kind of an arbitrary title for it. But what in fact it is that the condition that you have, the DOD or the Army believes that you will get better in time. And they're willing to say, we'll give you more, we'll make you say 50% for that condition, because we think over a period of up to 3 years, that condition is going to get better, and we're going to have the opportunity, DOD, we're going to have the opportunity to either decrease that rating, keep it the same, or possibly you will get worse. It also allows the military to return somebody to active duty, although that's a rare occasion. And I can tell you the only time I've seen that happen in the last 6 years is a pretty smart fellow who hurt his knee in AIT, and I think he was top of his class at Fort Sam in the medic training, and they wanted to keep him. So they put him on TDRL. He came back after his knee healed, and he was able to continue. That is essentially what TDRL is. Now, you do get reevaluated generally 6 months after discharge. So it will be at a location near you once you have left service. That examination is good for about 18 months. And so usually folks will get a decision in right around the 12-month period. And this is really an economics thing, because the military pays the VA for these they're all contract now, VA C&P exams. And so if they go beyond that 24-month period, you'll have to have another exam. Again, that exam is only good for 18 months. So in most cases, folks will come off the TDRL right around 24 months. Now, when you're in the TDRL, you're still considered to be part of the IDES process. And so you are eligible to have services from the Office of Soldiers Council, where I work. And we're more than happy to help. Again, it is as if you were still on active duty. You just appear in your civilian clothes, but what they're doing is trying to then make you go from temporary to permanent. I have listed on my resource page just a couple of what I find to be very helpful. There's DFAST site. So regardless of service or branch, we all look to DFAST for our money. And so they have some really good information links for both VA waiver, retired pay. It's a little bit complicated, but it does help to explain that. And of course, then I also added the ones for HRC, which is the Human Resources Command for the Army. More than happy to answer individual questions. I've given you my office cell phone number as well as my email. And I'm going to turn it over now to Josh, and he is a VSO in the state of Illinois.
All right, thank you, Michelle. All right, so my name is Josh Layton. Let me share my screen here. Do it this way. All right, as stated, I am a veteran service officer with the state of Illinois. Essentially what my job is like I'm a guidance counselor for veterans that just got out of the service that are looking at applying for their benefits. Now the VA has stuff that's a federal side, and then we have state level side. So I can speak specifically on the state of Illinois side. So if you're listening from outside the state of Illinois, there may be some different things that may be more specific to you for that state. So I'm going to go ahead start off by saying whenever we look at filing claims, I want to talk more specifically about compensation claims. So to file compensation claims, there are essentially things that we need to do before we go ahead and file it. Now, the VA, when they start looking into approving claims, it is very heavy on evidence-based things that are sent in. So normally whenever a veteran calls me and says, hey, I want to file a claim, so I'll use like Michelle's example of a shoulder. Now, a veteran could either be out of the service for a year, or he could have been out of the service for 20 years and just now starting to look into his benefits. The first things that we would look is at what I would ask is if at any point in time, if he was ever seen or if he ever complained of an injury of the shoulder while in the service. Now, to get something that's related to service, I consider that an exposure, an event, or an injury that happened while in service. So once you get the actual diagnosis of that while in the service, that's step one. Now, if you are within a year of being out of the service, the date that you were diagnosed with that and left the service is pretty much a stand-in or standalone thing to file for as is. Now, if it's beyond a year, so if you're a veteran that comes in 20 years after you got out of the service, then we need to start looking at different ways we can get that in there. So we already have the, if you have medical records from your military saying that you have a hurt shoulder, what we would need for that senior veteran is a most current diagnosed list. So what you would need to do is go to your doctor. It doesn't have to be through the VA. It could be a private doctor that could basically say the veteran has arthritis or degenerative arthritis of, the shoulder. So what that does, it shows the VA that even though there was an injury that happened in service, there is a current diagnosis of what that condition is for us to get that in there. Now, there are two types of disabilities that we can claim. I can call them primaries and I can call them secondaries. So the primaries would be that shoulder injury that we talked about. The secondary injuries that we can talk about is say that there's a nerve or something like that in the shoulder that is being pinched or that is being hurt due to the arthritis or some variant of, and it's causing nerve damage to run down the arm into like your elbow and wrist. As long as one is medically connected to one to the other, we can add that to a secondary condition. Now, whenever they start doing the ratings, like Michelle stated, that when it comes to pain, I believe the VA will only rate 20 to 30% for the pain. Now, anything beyond that, it is strictly range of motion. So if you have a secondary issue that goes along with the shoulder, it will be evaluated by itself. So it'll have its own disability percentage for that. So it's not like an apportionment or it's not cut in half. It's its own standalone payment. Now, the other side that I want to talk about is like if you're a veteran that didn't complain about this while in the service. So these claims are a little harder to get approved, but they're not impossible. So we'll go with the shoulder injury again. So let's say that you were doing PT or doing something, you hurt yourself. You just rubbed it off because you're young. You just rub some salt in it and you're fine, or dirt into it and you're fine. But down the road, you started developing arthritis in that. Okay, so there was an event, but it just wasn't reported while you were in the service. So what you would do is that if you could have buddy statements or statements written by your spouse or whoever that may be there, that can vouch saying that, hey, I, private, corporal, whatever it is, witnessed this incident that happened. Now with those statements, basically they're kind of like character statements that can basically help let the VA know that this incident didn't happen. And the VA is very open about reading and accepting these buddy statements to get that initial part put in the application. But you would still need to get the second part of it, which would be the current disability rating or the current diagnosis of that condition in there as well, so they have an idea of like where it's at. Now, the third piece of information you can have is called a Nexus Letter. Now, a Nexus Letter is a letter written by that primary physician. Now, it could be your doctor, but a lot of times if it's something like a joint or something like that, I want to go to more towards a specialist because they could speak a little more clearly. They could speak a little more professionally on that body part. Now, if they're willing to say that it is the result of your military service or is more than likely of your service, those are the two key terms that the physicians need to let the VA know to say, hey, this is an issue that happened while in the service, and I am, as a medical examiner, I am stating that this is a plausible case for that. So that's how you get the two check marks in there for that. Now, the other benefits we're looking at, we could look at pension, education, records, upgrades, VA healthcare, and some life insurance. But I think mainly what we're looking and focusing on is mainly the compensation portion of this. Now, what a lot of the benefits that we have, like the state level, are basically add-ons onto what you get for the federal side. So if you have a disability rating with the VA, then obviously you can start looking at a lot of the state perks, hunt and fishing permits, get into the VA healthcare system, camping permits, looking at the state war bonus, and there's a plethora of different things that I could really go into. Now, the way the process would work when we file a claim is that once we gather all the evidence, I would forward that up to the VA. Now, once the VA does that, they will take it and they start this process. First part is gathering the evidence. So they're pulling out your records back from your military service. They're reviewing the records that we send in. Now, there's two different applications when we send in for this. You got a fully developed claim and a standard claim. A fully developed claim is practically a claim where we send all the evidence at once. If you have your medical records that from the service, we would take out the portions of there that would talk about specifically what your injury was, and has the dates and everything that you were seeing while you were in the military. The other portions we would send in would basically be the doctor's notes and everything that you currently have that can talk about what your rating is, or what the issue is. And then what they would do is they would take that information, they'll start processing it. When they start processing, getting all the information in, then they'll start scheduling appointments with CMP examiners. Now, CMP stands for compensation and pension. And once the examiners, will send you give you a call first, and they'll schedule a date for you to meet a CMP examiner. Now, the way the VA works, it works kind of in this order. It goes by whatever location that has a contract with the VA through, it's going to go based off of your address where you live, and the whichever office has an opening first. So there have been some veterans got hooked up that have a CMP exam that's within the same town as them. Other times there's people that might have to go to a larger city like St. Louis or even Indianapolis, or a suburb of there, to get these CMP exams. So it's not uncommon. Now, the VA outsources these contracts with the CMP examiners through 3 different companies: LHI, VES, and I can't think. I just missed up the third one. But there are 3 companies that the VA does reach out. So if you do get a call from a random 3-letter agency saying, "Hey, I'm with the VA trying to set the CMP examination up," more likely than not, they are legit. Because I get a lot of veterans that call me and say, "Hey, I got a call from LHI representative. Who is this? Who is that?" They're asking all these questions. So they are a legit organization that do set up these CMP examinations. Now, once the VA or you get these examinations done, excuse me, then they'll take all the records that they have again, and the CMP examiner's notes, and then they'll take in the back and they'll start finalizing the claim. Now, from date 1 to date until the end of the claim is average about 6 months. It does take a process for that to do that. But however, there is a retroactive payment. So the date you file is whenever you get that, that's when they'll start paying all that stuff back. So there is retroactive payment during that 6 months of whenever you get it. Now, if you do get a service-connected injury and you do not like it or do not agree with it, there's a couple of avenues we can approach. We could look at appealing it, or you can apply again just to get a higher rating with submitting new evidence. Now, I'll let Mr. Parsons go into it more directly as far as the appeal process goes, but a lot of times what I do is that if they feel like they do not have a good evaluation, or if the evaluation was bad, you could request the CNP notes from the VA. Now, if the evaluator didn't do a very good job, and that your scenario or your injuries are worse than what the examiner stated, then we could easily turn that around and file for a supplemental claim to get that our disagreement with the VA for you to get re-rated for a higher percentage for that. One of the biggest things that I get from the VA, obviously, is 0% disability ratings. So a 0% disability rating is not it's not a denial. It's not like they're denying you of that benefit. A 0% means that, for example, for hearing loss, it means that the VA has said that you do have hearing loss, but it's not at the decibel levels of hearing to rate it 10, 20, 30%, because the VA uses elementary math. It goes by tens. If your rating goes to if it's a 14, it'll round down to 10. If it's 15 or higher, it would round up to 20. So if your decibel levels aren't to the point to rate a disability of 10% or higher, they'll rate at 0. All that means is that if your hearing does get worse down the road, you don't have to prove that your hearing loss is service connected because that's already there. All you have to do is file for an increase. Now, kind of going back to the programs and everything that you can do after you receive a disability percentage or a approval of a VA disability plan, or programs and things out there that you can definitely apply for. Now, when it comes to things outside the state of Illinois, I'm kind of like a Rolodex, where if I don't have an answer, I can easily give you an idea of who to talk to. One of the biggest people that I use with there's programs out there for disabled veterans is Illinois Joining Forces, which Jim Dolan will get on in here in a second, talk about it. Where if there's a program out there, or what I always tell people, like the bee's knees, people that know things that other people don't, I always refer them to Illinois Joining Forces. Because if there's a benefit out there that I'm not aware of, they will know where it's at, how to get there, or they will do their part in looking into that and giving you the answer that you would need. So I look forward to any questions. I'll put this down. Here's my contact information. I'm gonna roll this over to Jim Dolan with the Illinois Joining Forces. If you have any questions, I'm looking forward to answering them in the end. Thank you.
Thank you, John. Really appreciate the information. I'll share my screen now. So good afternoon, everyone. I'm going to shift a little bit from the focus on disability benefits to address some other concerns and resources for navigation support here in Illinois. As we all know, not only veterans, but we all deal with a multitude of issues and responsibilities. And we believe the best way to address those concerns and responsibilities is within community. Illinois Joining Forces was formed in 2012 as a public-private partnership to connect Illinois service members, veterans, and their families to the resources in the community that they need and deserve. So I'm going to focus on a couple of things today outside of disability benefits, but also to support you as you're going through the process. As Michelle and Josh laid out, you need assistance and navigation from the experts like Michelle and Josh to be able to do this. But in the meantime, Illinois Joining Forces can support you for those other things that you're working on and the other resources that you need. The number to remember is 833-INFO-IJF, 833-INFO-IJF, 463-6453. And that will take you to our team that serves the entire community. So we serve all branches, all eras, and all manner of discharge, active duty, guard, and reserve, all family members, caregivers, and survivors. So when we say all, we really mean all. We may not have a resource at our fingertips for everyone at the moment, but our team does a great job of digging in to find the resources that service members, veterans, and their families need. And so what we provide is holistic resource navigation throughout the entire state. Just as context, every state in the union is trying to figure out, how do we do this? How do we provide the support for service members, veterans, and their families, especially if we deploy some 250 or 400,000 troops again? How do we welcome them back and make sure that they get the services that they need? And so our job is to direct veterans, military members, and their families to the resources that they need when they need them. And we do our best to connect them to the resources closest to home. We believe that that's the best way to deliver resources and services and to do it in the community. So this is how we do it. And we're available Monday through Friday from 8 to 5. Our toll-free number again, 833-INFO-IJF. You can contact us at call center at Illinois Joining Forces. You can also go online to our website and click on our help button. You'll find there an application for services. It's very short. That application goes to our team and they'll respond within 24 hours to do a full intake to make sure that your needs are met. So the little bit about what makes us different, we're not just a directory of resource providers. We establish relationships with our resource providers to make sure that we can do a warm handoff to each of our providers so that your needs can get met. This warm handoff to our trusted partners enables us to go through a triage process during intake. And we take the most urgent matters first to make sure that if you need housing, emergency financial assistance, transportation, whatever that might be, we go through that list. And one of the things that it does most of all is that while you're working on a disability claim, again, it's not a very short process. Sometimes it can be very involved, but it's well worth the time to do it. Our team can be working on other matters so that you know you have us and we have your back when it comes to those other things. For the longest time, veterans and their families have been relegated to becoming resource experts. We don't think that they should be resource experts. That's what we're here for. And we connect with our partners in the community. Josh is a VSO with the Illinois Department of Veterans Affairs. We work with the Veterans Assistance Commission, VSOs, and the VA service officers as well. So if you have a disability claim and you want us to connect you to a VSO in your area, we can do that, but we can also provide you with support for other things. Our Veteran Support Community Initiative is designed to really connect veterans and their families back into the community. And we have established relationships with community collaboratives. After all, when somebody transitions out of the military, the objective is to transition into becoming a civilian and connecting into your community. So community partners that we've connected to have been doing this work for quite a number of years. Illinois Joining Forces' job is to try and pull them together so that they're not operating in silos. The trusted partners that we have here on the call are part of that to make sure that we're all connected. This enables us to foster better collaboration, share assets and resources regarding whatever the issue might be. It could be benefits, employment, housing, emergency financial assistance, all of the things that you might be dealing with. We're there to be able to support that effort. I'll be talking a little bit about our Illinois Military and Veteran Resource Project that allows us to be able to stay connected with our partners so that when somebody does contact Illinois Joining Forces, we can direct them to the resources in their community that they need. This is just a brief map that shows some of the locations where we have had connections within the community. We have established veteran support community collaboratives in Lake County, Rock Island, the Quad Cities, Peoria, Quincy, Springfield, Metro East, and Southern Illinois, and we're growing to be able to make sure that not only can we connect veterans to these resources, but that we're continually growing the resources that are available to veterans and their families. So I mentioned earlier the Illinois Veteran and Military Resource Project. For those of you who are providers that may be on the call, I'm going to be putting in the chat some information about how to contact Illinois Joining Forces, my own personal information, but also a link to the Illinois Veteran and Military Resource Project. It allows us to be able to gather the resources throughout the state and make sure that we have resources at the ready to be able to meet the needs of anyone in Illinois who might be in need. So again, appreciate the opportunity to be part of this program. Thank you to the Road Home for organizing it. I'll be available to answer questions later, and look for the information in the chat. You can cut and paste that, save it. But that number to call again is 833-INFO-IJF, 833-INFO-IJF for any needs that you might have in the community. And with that, I'm going to be followed by Martin Parsons with the Veteran Legal Assistance Program Clinic. Martin?
Thanks, Jim. I think I'm unmuted. So I'm going to talk about the appeals process. Josh did a great job of some of the basics setting this up for me. And as a caveat, this is just an overview of the appeals process. My intent is to help you understand the process better so you can be a better partner in your claim, or if you're a service provider, you can help your clients understand the claim or navigate the claim. I'm not going to use slides, but they're available in that resource link that Chris sent out to you, in addition to my contact info and any other resources that I mentioned. They're all in there. So to start off with, if your claim is denied or you don't get the percentage of the disability that you think you should have, you should appeal it. But don't go it alone. Get help. In Illinois, we have the Illinois Department of Veterans Affairs, VSOs like Josh. They're very knowledgeable, very well trained. Many of them can assist with appeals. Typically, when they get into a point that they can't is when they refer you to us or to another provider. If you live in another state, you'll have to research your resources, or Josh offered, he has some connections elsewhere, may be able to help you with that. So I'll offer Josh up for you to reach out to him to help with that. You could also get an accredited attorney. In Illinois, the University of Illinois, Chicago, John Marshall does VA disability claims appeals. We also do those here at SIU. And a great separate resource is the Illinois Armed Forces Legal Aid Network, ILAFLAN. It is a statewide network of attorneys who help with a variety of civil legal matters, not just VA claims. And that number is also in the resources that I provided. So it's important to understand why your claim was denied. There can be a lot of assumptions about why it was denied, but you've really got to understand the specifics of why it was denied. And to do that, you need to read that denial letter very carefully. The VA has to provide you with a written explanation of why they denied your claim. Unfortunately, in that letter, there's a lot of cut and paste, boilerplate language that they copy from claim to claim, and typically only a paragraph or two of the specific reason for the denial, or what elements are missing. And most of the time, it's very confusing, which is why you need an advocate to help you through the process. The next thing you need to do is get a copy of your complete claims file. You can request that from the VA yourself, or another reason to have an advocate is a VSO or an attorney should be able to get your complete claims file from the VA, from the VBMS system. And it's important to see all those documents and why the VA made the decision that they did, because you can't fight the decision if you don't know what it was based on. And it's especially important to get copies of those CMP exams for your disability. As Josh mentioned, those CMP exam notes, you need to see what the doc was thinking. And I'll talk more about that a bit later as well. But you got to remember that even if Josh is helping you or I'm helping you on your VA claim, or any representative, it's ultimately your responsibility that any deadlines are met. And I'll hit this several times throughout my presentation. Deadlines are crucial. So you've got to make sure that if you have a claim in the process, that you meet those deadlines. It doesn't seem fair because you've turned your claim over to an advocate to help you, but it's ultimately your responsibility that the deadlines are met, and there's a lot of law that speaks to that. I categorize the reason for denial, at least for this presentation, basically into two categories. There was a weakness in your claim, something was missing, a piece of the puzzle was missing, or the VA messed it up. They made a mistake. So we'll start with the first one. We'll talk about that mostly, is a weakness in your claim. So again, Josh spoke about several of these kind of briefly. I'm going to talk about them again. So there's three elements of a claim, or three pieces in the puzzle. I kind of like to visualize them as pieces in a puzzle. And you've got to have all three pieces to complete the puzzle and win your appeal. So the first one is a documented in-service injury. Documentation, Josh mentioned it, is so important. It's an evidence-based system. You have to have a currently diagnosed medical condition, and then the medical nexus that ties those together, and we'll explore those individually. So the first one, the documented in-service injury. And in my experience, it's the most often missing element of the claim or missing piece of the puzzle. And it's probably the most difficult to fix. If you're in the Marine Corps or the Army, you're probably missing records. They told you to rub dirt on it and walk it off, and you were young, and so you did. And now there's no record of that injury. And now you've got arthritis, and I can't help you. The Navy and the Air Force, fortunately, make their folks go to sick call for just about anything and everything. And as an advocate, I'm grateful because I don't see as many problems with their claims because they have the documentation. And you've got to have the documentation. So what is an in-service injury? In its most basic sense, it's any injury that you incur while you're on those active duty orders. From the time your DD 214 says you entered service to the time that you are discharged on that, and the date on that 214. If you are home on leave and you twist your ankle playing basketball, that's an in-service injury. It doesn't have to be in combat or doesn't have to be driving a military truck. Any injury or illness that's incurred during service, except for if it's the result of your own misconduct. If you're home on leave and you're drunk and you're dancing on a bar and you fall off and bash your gourd and now you can't see and you're paralyzed, you most likely are not going to be service connected for that injury because the VA considers that alcohol abuse, they call it abuse at that level, misconduct. So we're going to talk about, I already have an example of a knee injury I like to use for Specialist Jones, who she was at air assault school and she was in the last week, she's in her final exam, final test, and she's rappelling down the wall, and her belay man is dreaming about home, isn't paying attention, and lets her fall. And so she comes down hard and she jams her knee. So she walks over to the medic. He gives her some ibuprofen and bandages up her knee and says, you really probably ought to go to the hospital for that. It looks pretty bad. It's like, no, I'm almost got this. I got to finish it. So she drives on, she graduates, she gets her air assault badge, and she's excited. But there's no record of that injury because that medic, he was in the field. He didn't write it down. He just, there's no way to, he's not documenting the ibuprofen he's given out. There's no record now. And later her statement when she writes her claim doesn't matter either. And I can't make a compelling legal argument to fix a lack of evidence. There's just no way around that. But there's hope. There are some possible ways to support it. Josh mentioned some of those too. Buddy statements. So let's say Specialist Jones, she's back in the squad bay. She's relaxed and recovering, all aglow from getting her badge, and her bunkmate next door says, I saw you limping in, Specialist Jones. What's going on with your knee? She says, well, she tells her the story about the belay man letting her down, and she hurt her knee, and Specialist Smith said, man, you ought to get that looked at. And Specialist Jones said, I can't. I'm not staying at Fort Campbell another day, and we graduate tomorrow and we're leaving. I'm not going to the hospital. They're going to hold me over. So she doesn't go, but Specialist Smith was there. And if we can get a hold of Specialist Smith, maybe we can get a statement from her to support that injury. Or maybe Specialist Jones sent an email home to talk about her victory, success of getting her assault badge. She's excited, and she also relays the story about the belay man dropping her and her knee hurting. And if we can get a copy of that email or a letter home, then that's also evidence. Anything that we can use to show that something happened. If there was a car accident, a police report might help, or if it was a fight, a police report, an assault, incident logs, possibly. First sergeant's logs of the overnight thing of things that happened, if we can track them down. News reports, depending on the significance of the event, are all things that we can use. But it's very challenging if there is no evidence. The next element, even though a little out of order, but it's for me the second most common reason for denials is a medical nexus. And so the medical nexus typically comes from the current disability, but it's this magic language, this magic legal language that we need to see, more likely than not. So using the example that we had with Specialist Jones and her knee, we want the best place for us to have that is the CFP examiner. It says that in his or her examination. Of course, if it did, you wouldn't probably have gotten denied and we wouldn't be appealing it. But we can also get a statement from our physician. Maybe Specialist Jones has been seeing an orthopedist for 20 years about the arthritis in her knee that she has now, because this happened back in the 90s. And so she's seen an orthopedist, and if she can get that person, that doctor, to write her a letter, and in that letter use that language, more likely than not, Angela Jones' arthritis is a result of her injury in service. That's a really good medical nexus opinion if the doctor supports it sufficiently with a reasoning. He or she, they can't just say, I treated Specialist Jones for 20 years. More likely than not, her arthritis is a result of her service. They've got to be able to support it with more specific discussion of the diagnosis and tying it to treatment and why it is from her service. Another way to get that is if the Specialist Jones doesn't have, or you don't have your own physician, is you could pay for a medical expert opinion. They typically cost $1,200 to $1,500, depending on the provider. And I like to talk to my clients about looking at that, depending on how much I think it will help them, as a cost, kind of a cost, like it's an investment of sorts. When you think of the cost of paying for that opinion in light of the long-term benefits that you could get through your monthly payment and even back pay. Oftentimes a back pay check would cover the cost of that private medical opinion. And if we can get that medical opinion from either a private physician or an expert, and the private physician says, yes, more likely than not, it happened in service, and the VA doc had said, no, it's less likely than not. And our private physician, they supported it with good language, then if those opinions are equal, all things being equal, the VA is supposed to give the benefit of the doubt to the claimant, to the veteran, and grant that benefit. And I say supposed to, I use some of that squishy lawyer words because it doesn't always happen, but the law says that they're supposed to give the benefit of the doubt to the veteran. So then we move on to the third element, the current disability. That seems most obvious and easiest, but not always. So it must be a current medically diagnosed disability at the time of application and exam. And there are some exceptions. The VA has identified some undiagnosed illnesses. Many of those are from the Gulf War era, abnormal weight loss, chronic fatigue syndrome, some skin conditions that they don't undiagnosed, so they are more difficult, not as easily defined. And presumptive is another category of disability, but it doesn't always mean automatic either. So from Vietnam era and some Gulf War era injuries, if a service member served in those areas, there are some disabilities that are presumed to be service connected to service. But presumptive doesn't mean that you get it unless the compensation unless you actually have the current disability. I worked with a veteran who served in Vietnam. He was out in the boonies, but he didn't have any of the presumptive diseases, fortunately for him. But he would go to the VFW, and he's hanging out with his friends, and they were served in Vietnam too, and they're getting disability payments, but they've got type 2 diabetes and other illnesses from their service, and that's why they're service connected. Even though quoting him, he had that Agent Orange in his blood, he couldn't be service connected without the current disability. We run into similar challenges when cancer goes into remission. A veteran might be service connected for cancer at a certain percentage, and then through treatment, he goes into remission. And typically, upon re-examination, that's going to lead to a reduction or could be a loss of benefits. And that can be really tough when someone goes from 100% disability to 10 or 20%. It's a significant life change. Improvements in mental health conditions, such as PTSD or depression, can also lead to a reduction or loss of benefits. In fact, improvements in any condition can mean a reduction or loss of benefits. The VA system is not set up, it does not incentivize us to get better, unfortunately. And while we're talking about reductions, there are some securities built into the process. If you have a VA rating that's been in effect for 5 years or more, it can't be reduced unless your condition has improved on a sustained basis over continuous examinations. And any compensation and pension exam the VA uses to reduce your disability must be the same thoroughness as the exam that was used to award the rating. And that's really important, especially in this age of a lot of outsourced examinations not done by the VA any longer. I had a patient who had ischemic heart disease, and he went in for his evaluation. He was between his 5 years and 10 years, and he went to an outsourced C&P exam, and the nurse practitioner didn't take his pulse. He didn't put a stethoscope on him. He didn't put a blood pressure cuff on him. He never touched my client. He asked him a series of questions, and from that exam, reduced his benefits, his service connection from 70% to 10%, because he said he was better. And we argued that the exam wasn't of the same quality and thoroughness, and the VA accepted that argument and fixed his percentage. If your rating has been, if you've had your rating for 10 years or more, you're pretty much locked in. Short of fraud and misrepresentation, you should be covered. And if you do get a notice of reduction from the VA, it's a multi-step process. They will notify you of a proposed reduction. As soon as you get that proposed reduction, get in touch with an advocate. Call Josh, call somebody else, because you have a very short window to file something with them to disagree. it's not a full-blown appeal at that level, but if you don't file something to disagree within that short window, then the process moves on, and at a certain point, then they will reduce you, and then you have to appeal the reduction. And the whole process can take 18 to 24 months. So if you get the notice and you respond to the notice timely, they won't enact the reduction until the paperwork is completed, so that even if you aren't able to prevail in an appeal against the reduction, you still will have a longer period of time to receive that money, and then they will not go back and take that money from you later. So then moving on to the second category, the VA error, things that the VA does. And this is not every mistake that the VA could make. Every claim is different. It's one of the challenges of VA law that the facts for every case is different. So these are just some of the big ones. And sort of as a caveat, or I don't know, so a little bit of support for the VA. They process a lot of claims, and they're people, and they make mistakes, and there are a lot of claims to be adjudicated. I've spoken with people who work at the regional office and the Board of Veterans Appeals, and I feel like, and they tell me that they want to grant the claims. And maybe I have to believe that, or this would make my job a lot harder. But they tell me it's easier for them to grant the claim than to deny it, because if they grant it, it's done. If they deny the claim, then most likely it's going to be appealed, which causes additional work for another VA employee and keeps that claim in the system. And that takes time away from processing other claims. One of the BVA attorneys, the Board of Veterans Appeals attorneys I spoke with, put it this way: I want to say yes. Give me a reason or law, give me the evidence or law to help me say yes. So I look at my job as to help them say yes. So the adjudicators sometimes overlook medical records, or just records in general that are in a VA claim. When they send your denial or your decision, it's supposed to list all of the evidence they considered in deciding your claim. And sometimes it does include all the evidence, but sometimes there's evidence. So the assumption is, if that's what's listed, that's the evidence they reviewed. And so if there's evidence in your record that's helpful to you and it's not listed, then that's a really good reason for an appeal, and to point that out during the appeal. But they overlook records, either medical or military service records. There are thousands of pages in many veterans' files, and an adjudicator they've got quotas, they have a limited time. And so they're gonna miss things. It just happens. Sometimes an adjudicator can misinterpret the medical records. They will read the doctor's C&P exam in their notes and misinterpret it. They could read it wrong. I've had medical examiners, C&P exams where the doctor clearly said, more likely than not, it's connected to service, and the adjudicator just flat missed it. They misread it and misinterpreted what the doctor said. I wish all the appeals were quite that clean and easy to correct. Sometimes the doctor can make incorrect or contradictory conclusions within their own C&P exam. They can contradict themselves. And I'm not a doctor either. And fortunately, we have the internet, we're able to read things, but it doesn't necessarily take a doctor to be able to read through their notes to see contradictions either. The VA might not consider all theories of service connection either. And I won't go through all of the theories of service connection, but the top two are direct service connection. And in our example for Specialist Jones, she hurt her knee, now she has arthritis. that injury came from service, and her knee injury is what hurts her now. So that's direct service connection. But she also now has a limp. So she's walked, she has a limp. She never really, it's just never been right. But that limp hurts her back. It's got her back out of sorts. So that bad back could be secondary to her knee injury. And if we can get her knee injury directly service connected, we've got a good shot of getting her back secondarily service connected. But even if in the application, even if Josh doesn't think about specifically mentioning her back is secondary to the knee, the VA, in reviewing the medical records, is required to consider that theory of connection. And if they don't, then that's the job of the appeal, your advocate, to help point that out. We're about done, wrapping up with the appeals levels. Again, this is just important, I think, for you to understand all the process and the levels. So the first level is the regional office. That's where you file the claim initially, and that's where the claim is initially appealed, is at the regional office. The people who work at the regional office are not attorneys. They are trained in VA work. Some of them have more experience than others, but their job is to decide claims and then review the appeals. And then after that, we have the Board of Veterans Appeals, the BVA, and those are attorneys. And so when we appeal to the regional office, we don't make as legal an argument as we would at the Board of Veterans Appeals. At the board, they're more receptive to case law and legal arguments. And then if we lose there, then we can appeal to the Court of Appeals for Veterans Claims. It's a federal court that only hears cases from the VA. That's their whole job. They don't hear any other cases but veterans claims cases. They're very knowledgeable because that's all they do. There are two statuses of claims. What we call the legacy appeals, which are claims that were filed before February of 2019. There aren't too many of those still out there, but there are a few. And they have a certain process. You get a notice of disagreement, could file one appeal, and then you have to file to the Board of Veterans Appeals within the 90-day time frame. Those older appeals had the opportunity, when the Appeals Modernization Act came into play, to opt into the new process, but many of us were really unclear about that process and uncertain about how well it would work and how it would work. So we didn't always encourage our clients to opt in there. The Appeals Modernization Act, the effective date was February 19th, 2019. So any claims after that date are always then considered under the new process and the new claims lanes. And with the process, it gave the claimants, gave you more opportunities to appeal your claim. In the old days, you filed a notice of disagreement. You had one opportunity at the regional office. If you didn't make it, you had to go to the board. So now we have different claims lanes. We have the supplemental claim, which is the first appeal level at the regional office. So you receive your denial. You have 1 year from the date of the letter, the date that's on that notification letter, to appeal, to file a supplemental claim. You can add additional arguments or evidence. The interesting thing about the new process is if you're denied, if your supplemental claim is denied, and maybe in the meantime you found a box in your basement and it's got the evidence you need, you can file another supplemental claim, another appeal to the regional office with that new evidence. And technically you could file as many supplemental claims, supplemental appeals as you wanted, but you would need to continue to improve that claim. You You couldn't just resubmit the same claim, but you do have the opportunity to submit more than one of those. If you get everything in there, you've exhausted it, then you could go on for a higher level review. You also have 1 year to file to the higher level review. Those are reviewed still at the regional office, but by a more senior adjudicator, someone who has more experience than some of the others. They're supposed to review it afresh, de novo, not taking into account previous denials. I find it hard to believe, though, that they're able to really do that. When you're reviewing a claims file, part of that review is they're going to see the original denial. But it's an option. And you can also request a board hearing or a hearing with an informal conference with the hearing officer that can also be really helpful as part of a higher level review. If you aren't successful at the higher level review, we've got yet another opportunity to appeal. You have 1 year now under the new Appeals Modernization Act to appeal to the Board of Veterans Appeals. Now you file a notice of disagreement with the BVA, but you have more time to do that. So as I mentioned, deadlines are crucial. It's important that you read your notices carefully. And if you don't understand, get help. Call your VSO, get help from a representative. I think it's important that you're involved in your claim. Nobody knows you or your claim better than you do, but don't overwhelm your advocate. Most likely, they've been doing this a while, may know a little bit more about the process, but you know your health, you know a lot of things that are going on with you, so it can be helpful for you to be involved. Be prepared for the wait after it's been submitted. Wait times vary on an appeal on a lot of factors, but you can expect to wait for the first time you appeal 12 to 18 months. But I've had them come back as quick as 3 or 4 months or as much as 24 months for appeals at the regional office. And then if you're denied there and you eventually appeal to the Board of Veterans Affairs, the BVA, it can take 2 years or more of wait there. The good news, though, is you've been involved in your claim, you've been watching your deadlines, and as long as you meet all your deadlines, that effective date, the date you filed your claim, is the date that when you receive your disability compensation, that you'll be compensated back to that effective date. That's why it's so important to meet those deadlines. And I don't know, third, fourth time I'll mention it, I'm not sure. Don't go it alone. Get help from a VSO or an attorney. A great resource, again, is the Illinois Armed Forces Legal Aid Network for either VA appeals, other civil legal matters in Illinois. Their number is in the resources I provided. I'm welcome. I'll also answer questions. You can email us at the school at the email provided and contact information as well. So thank you for attending. Have a great weekend, and I will send it back to Blake, our moderator, to field questions. Thank you.
Thank you, Martin, and to all our guest speakers. We are now going to switch over to the Q&A portion. Thank you for the participants, individuals who have already sent public or private questions. So I'm going to go ahead and get us started. The first one's a two-part question. Can I get a VA payment or a VA disability and a DOD retirement pay at the same time? So can I collect both disability?
Yes, I can answer this one. All right, so yes, you can. So the process of it is, oh, I'm sorry, Michelle. Michelle could, if I misspeak, Michelle can correct me on this. So there is a benefit out there called CRSC or CRDP, okay? And CRSC is if you have an injury that was service-related that basically got you out of the service, and CRDP is basically you did 20 years of service and you have a VA disability. So normally how it works with the older veterans that were not or did not leave the service due to a service-connected disability, the ratio of how it works is that you have to have at least a VA disability 50% or higher. So if you have a 50% disability rating or higher, you can collect both your VA payment or your and your retirement. Now, normally how it works is it's kind of a $1 for $1. So the VA pay is non-taxable where your retirement is taxable. So let's make things simple. So let's say your retirement is $500 a month from the military, right? But your VA pay is also $500. So what you can do is you basically offset that because there's an application like within a claim for the VA saying, do you want to receive compensation pay or do you want to receive military retirement pay? So if you click that box and you're under that 50% range, then basically you will not get your military pay, but you get your VA pay for that amount, but just non-taxable. So there are two different ways to get that. Michelle, if you want to clarify any of the issues that may have missed or maybe misspoken.
No, I think you have it covered. I did include in my links the DFAS explanation for VA waiver when you waive your retirement pay for your VA pay so that it can be tax-free. But so it is in the links that I provided to DFAS.
Okay, thank you. And now specific to this individual's question, because I wanted to kind of go out and then come in and be a little bit more specific for this individual. So can I get a VA payment and my retirement pay? I get 50% of my retirement, so DOD. VA rated me at 100%, but said I'm still in the military, so he's temporary disability. So I'm still in the IDES system. Can I collect both? There's no chance of me returning to the Guard or active duty. I was retired while on active duty for PTSD and depression. Does that make sense?
Okay, so normally how it works is that if he is a drilling National Guardsman, you can't get paid for drilling and VA pay. It's also offset.
So this individual is retired.
Mm-hmm. But he's still in the system?
Correct. Michelle, you're muted.
Yeah, he's TDRL, he's temporary disability retirement. So if he is not a length of service retirement, the only benefit he gets from the DOD is his TRICARE, unless he's a length of service retirement. So his money comes from the VA. And of course, if there's combat relatedness, then he may also get a CRISIC or combat related special compensation check as well. But the DOD is what he gets from them is the TRICARE.
Okay. And this is probably maybe a question, if people have questions they want to ask more, can they contact you guys, right?
Absolutely.
Okay.
Absolutely.
And we'll send out a recording, which includes everyone's contact information. So
Yep.
if at any point, go ahead.
I went ahead and put my contact information on the chat for everybody to see. So if they have questions offline or something like that, they can reach to me that way.
Okay. Yeah. Again, and we know there's some limitation, and we may not answer everything that you're looking for. So again, if you have more specific questions or we didn't answer something, you can contact the guest speakers. So the next one here is: can someone address disability benefits for military sexual trauma victims and with clear service connection, meaning documented by a CID report or court martial? I have heard that even with traumatic sexual assault, if the survivor or victim is able to maintain a job, but still might suffer from night terrors or anxiety and depression, she or he is not eligible for more than a certain percentage of disability.
Okay, so for the MST, it's kind of under the umbrella term of PTSD, which Blake can kind of speak on that specifically. Whenever we file for PTSD, there's normally a form that we send with it the VA asks. Even if you have been clinically diagnosed with it, even if you have it on your records, there's still a form that we have to send into the VA that kind of basically tells what things that happen that caused this issue. And one of those is it's basically called a stress. I can't remember the actual name of it, but basically like PTSD that's non-combat related, essentially like stressors. And what they would do, they write down and say, hey, this is what exactly happened. And when we send that in there, it's very similar to like when people fall for PTSD, because PTSD is an umbrella term. That underneath the umbrella, you have like depression, you have anxiety, you have X, Y, and Z factors. So if you do suffer from MST, the overall rating for MST may be 50, 70%. But if you have other issues that are that underneath that, we could file for them separately, saying, hey, if she's having like night terrors or like sleep apnea or anxiety, these issues, we can definitely touch on those. We can file them separately, try to get that rating up higher. Or really what it comes down to is whoever you're seeing as like a counselor or someone that you're seeing offhand, like, the Road Home Program, or even through the VA or some other private psychologist, something like that. They're the ones that are basically writing the evaluations, and their evaluations are what's being sent to the VA for the evaluators to look at to basically rate where you're at. Because I believe the PTSD goes 30, 50, 70, and 100, if I'm correct. So if she's not getting the higher evaluation that she believes, then basically what I would do is I would take her last evaluation sheet that she got from the VA that put her at whatever position or whatever rating she was, take that to the psychologist, say, hey, listen, the VA and the examiner is, because it has a blurb on there saying exactly why they rated her at that rating. You take that to the psychologist and, hey, this is what they are saying per the notes. Now, the psychologist might give you the bad answer saying, yes, that is where I rate you. That's where I see you at. Or your psychologist will be like, no, your symptoms are a little worse than what they are. And he can help you, write a letter, or write a more strengthening letter, or put something in his notes that can definitely help persuade the next time you file for that increase. Or if you want to go back to the original case and try to get that, you can try to get that higher. So when it comes to like getting a job or something like that, normally that's not a factor for that. It's really debated on the evidence that you submit to the VA from your provider that has seen you for that condition, and how they can basically talk to you about your symptoms and your issues, and how that relates to you personally is what they're going to base your percentage off of.
Yeah, if I could just add too, I mean, mental health disabilities, especially PTSD, are really difficult because mostly what they're basing that on is the CMP exam when that veteran goes in, and it's that, even though they're supposed to review, in my experience, they're supposed to review all their health treatment records, but that snapshot in time, the day that person goes in and is examined for that CMP exam, they've had a good day or they've had a good week and they're not exhibiting the symptoms. Maybe this veteran hasn't had the night terrors for a week and she goes in for her CMP exam and she's doing okay. It's really difficult because then they're being rated for the most part on that single examination. And that's the same way with reductions down the road. Again, someone comes in and it's been good. And they because the examiners, they look at how they comport themselves that day, how they speak. There's so many things they look at versus even just the specific symptomology. But they're really, really challenging and subjective because a veteran might go to 3 different CMP exams and be rated separately by each of them, or not rated, but provided an examination that is different, even though the disability benefit questionnaires, there's a DBQ, which are all on the VA's website now. They're back. They were gone. They're back for PTSD, for example. And if you are working with, if you have clients, this would probably be a good resource for anyone who works with clients to have. And we would send, if I have a veteran who's going to go in for their PTSD examination, they need to understand the things that the examiner is looking for and kind of be prepared for this exam, kind of studying for the test, not necessarily, but they need to understand that when they go in, they've got to be open and honest about really what's happening. I find it mostly with guys, because that's what dudes do, is we minimize our symptoms. We go in, yeah, I'm okay. Yeah, it's not really that bad. Well, if that's how you go to your examination, then your rating is going to be not that good. But if that's not truly how your family sees you at home or the work sees you, educating, I think it's important, whether it's mental health or any other illness that somebody might, or things might be checked on, is to have that DBQ, because that's what the VA examiner is using, especially in mental health. They break it into 5 categories that they look at to determine if they're connected, and then the severity. And it's important to be educated when you go in and being honest, but it is subjective. There can be veterans who are at 100%, holding down jobs. It would appear that they're just fine, and you wonder why. How can that be? But it is. It's challenging.
Can I just add a little bit? What the examiner is looking for is occupational and social impairment. And so if you look at the ratings, and behavioral health can be rated anywhere from 0 to 100. 10% is for mild and transient symptoms. We don't see that a whole lot. But you actually, you have to have more in one section than you have in another of the symptoms. So if the provider can be given what the VA is looking for, then it helps, I think, the provider to look, is this person really a 30 or a 50, and then be able to record in their notes specifically the terms that the VA uses. And I say that because the rater who does this is not a lawyer, is not a doctor. They're really following a logarithm that says, if this, then that. So the person who might have suicidal ideations, the first time we see that is at 70%. But again, if somebody has more in the 50% than they have in the 70, then what you'll see is the 50% is a sign. The other thing I think that's important to know is it doesn't matter what we call the behavioral health condition, anxiety, depression, obsessive compulsive, unless it's an eating disorder, they all fall within the same rating schedule, which is occupational and social impairment. So I think that's important to know, and often we might also talk at this point about TBI, because traumatic brain injury often has symptoms that overlap into behavioral health, which can be very difficult for veterans to say, to realize, well, wait a minute, I know all of these emotional issues I'm having relate to my TBI, and yet I'm only rated on behavioral health and not rated at all on TBI. And the reason for that we'll hear from the VA is that we can't distinguish one for the other, but in general, behavioral health rates higher, so they give the benefit to the veteran than they do for TBI. So maybe a little bit far from where we started with military sexual trauma, but again, it doesn't matter where the symptoms came from, as much as it matters what the social and occupational impairment that the trauma caused. So.
Thank you.
Yep.
Next question. Do you have any contacts or anyone I should try to reach out to in regards to helping me with filing a claim? This person lives in Florida.
Okay, normally what I do is if you're a member of like the American Legion or VFW, you could look on, like, go to Google and type in veteran service officer with them, or if you know what count, because obviously I don't know where in Florida specifically, you could reach out or do another Google search, put like veteran service officer, whatever county you're in Florida. I've had to use it a couple times where, like me, I'm with the state of Illinois. Every state has like state veteran service officers that are in each county. So I would definitely just do a quick Google search, put like Florida veteran service officer, look at your surrounding area, and a map would show where they're at, where you can reach out and contact them. If you need a little more specific information or how to search it, you can always reach out to me, email me, tell me where you're from, and I could definitely give you a list of veteran service officers in that area. But most of the stuff is an easy Google search. But I know sometimes people are afraid of clicking like, like a law group or something like that, will start hounding them on their phones. If they reach out to me, I'll be more than happy to kind of push them towards that area.
It also looks like someone helped us out here and put the VSO link in the chat box as well. So click on that. It is a helpful tool, for any state. Next question here. Are there any specific standards for reviewing claims after they have been rewarded? Time period, types, what happens if somebody isn't engaged in ongoing mental health care, for example? That's the question.
All right, can you repeat that or just kind of go through it again real quick?
Yeah, so it's any specific standards for re-reviewing a claim that has been rewarded. So I think what I'm reading between the lines is, what is a circumstance where maybe someone could have been awarded a claim for PTSD, and then now the VA is saying, hey, we want to review that and see what's going on.
Okay. A lot of times what happens, and this happens a lot, not with just PTSD, but one that I see a lot of are veterans, Vietnam era, that have like prostate cancer. A lot of times prostate cancer only has like a certain limit before the prostate is removed. And kind of like what Martin talked about earlier is that, if the prostate is removed, then there's no more prostate cancer and the rating will get dropped. Now, then we start looking at other factors, but that's a conversation for a different time. Normally, before that 5-year timeline that Martin talked about, there is a possibility the VA can ask to review it, especially if someone has we'll say a PTSD that is like 100%. Within that 5 years, the VA could say, hey, before we get that timeline, we just want to reevaluate you to make sure that you are making progress, or if you're essentially still at that point that we evaluate you to begin with. What I tell veterans is have you been still being treated for this? Have you been seeing psychologists? Have you been staying on top of your treatments, if you want to say? And a lot of times they say yes. So, I mean, there's that evidence to support them when they go back to reevaluation for a doctor to say, I've been treating this guy for so long. His evaluation at 100% rate is still, reflecting what this veteran has. It just, he's just is that severe that there's just not much of a change. The counter side of that is that if a veteran does have a high rating for that, and stick with the PTSD category here, let's say that the veteran, has a revelation where he's able to adapt and overcome these disabilities. Now, or that specific one. Now, specifically, they will reevaluate him and say, hey, you are doing better off than what you were. But like Martin also said, that might be a day where they're having a good day, and his other, 90% of the time, he's not been in a good area. So best thing to do is that if you get a 100% rating on something like a high rating or something that, could be looked at, is just because you get the rating does not mean to stop getting the treatment or stop getting things recorded. If you still have these issues, obviously, continue with your therapy, continue getting seen by your medical team, your primary care physician, your PCP, just so that they can continue with those records. So when the VA does look into it, they say, oh, look, this guy has been seen since he got his evaluation done, got his percentage, he's still being seen and treated and complaining about these issues. So really for them to go back and re-review it, it seems like more it's like I think it's a 5-year rule, because after 5 years, whatever rating you have is what you get.
Okay. Any other feedback on that question? Next one. I'm ready to start a VA claim. What challenges should I be aware of given the COVID-19 situation? So.
Okay, that's a big one because I think we've approached the year mark of COVID. The first thing you want to do is put an intent to file in. Okay, now an intent to file is basically a bookmark from the date he sends it. So let's say that like today, I submit an intent to file to the VA saying I have a claim, I just don't have the evidence, or I'm just not prepared for it, or whatever reason. But what it does, it sets that bookmark for April 16th. Now, life happens, I get busy, COVID-2 happens, and things shut down again. 6 months down the road, things open up, and I start getting all this evidence together, and I'm ready to file. So when I file that claim 6 months from now, and everything gets seen, and everything gets approved, they will start the back payments or the back date on that date of the intent to file. Now, the intent to file is only good for 1 year. So if you go beyond 1 year, it basically just gets thrown into the trash. So what you would need to do if you're getting ready to start a claim is definitely do the intent to file first, gather your evidence, figure out what it is that you want to file on, what conditions you either A, can easily link to your service, 2, depending what generation you're in, like Martin touched on the presumptive list. Like everybody's DNA is different. Everybody's reactions are differently. So if it's like a Vietnam vet, he may have been in Vietnam, been sprayed with Agent Orange, but he's not hitting these, the different injuries or different diseases that comes with Agent Orange. So what I would do is I would just go get a problems list, something you can get from your primary doctor, someone that's seen you all this time, to figure out, what diagnoses that you've been, diagnosed conditions you've been seen for. It could be wrist, back, hearing, whatever it is. And then start looking like, hey, this is what my current disabilities are. This is what I'll file on. Is there something there? Yes. And then you start kind of backtracking. Okay, how can I relate this to my military service? Do you have any of your military service records, or do you know of any times where you may have hurt your back, hurt your shoulder, something that might be documented into your medical records while you're in the service? If not, that's where we start looking at the buddy statements, start reaching out your contacts, reaching out your old, your old guys you ran around with while you're in the service, or even spouses. If the spouse can say, hey, excuse me, allergy season. Allergy season. So if like a spouse that was there or a girlfriend at that time that knew him before, veteran didn't have this issue, didn't have problems with this, but after a service or while he was in, hey, I started noticing these changes. I started noticing his complaints about this. Those are the statements that they can start compiling. And the better you write not the story, the better you write your letter, the better off you're going to be to paint the picture for them. I know people in the military, they hear paint the picture. So you want to say like, Mrs. Smith here, my husband started complaining about his back while in service, and she signs her name. That's not going to be a good enough statement. Try to be a little more specific with timelines, figure out what it was, and they go off of that. So when you're getting ready to develop a claim or getting ready to start a claim, the first thing I would do is file the intent, gather the evidence, and then obviously find a veteran service officer in your area to review your evidence, because you always want someone to look that's outside the box to actually look at it and say, hey, you have a well-developed claim here, or you're missing small tidbits here and there that can definitely help boost you in the right direction.
Follow-up question to that is, can you submit another intent to file after the first has expired?
Yes, you can. The issue is that the clock restarts. So if you file it on April 16th, 2021, the next year, April 16th, 2022, you can refile it. Yes, it will not go back to the original one. It will only go back, the clock would restart. So once the year mark is over, it ends. Then you would file a new one, and then the clock will start again for the next year. So you can file another one. Yes, it's not going to go back the previous year.
Okay. Along those same lines here, what happens if I miss my deadline to appeal? This one maybe Martin. I don't know if under your section there.
Then you've got to start over. You've got to file. I would immediately file an intent to file to get it restarted, in case it takes a little time to fumble around and get it going. But you've got to start over if you miss that deadline. That's why they're so important. The VA, even though we had a window during COVID where they were a little more flexible about some deadlines, they gave us the opportunity to fix it if we were a little late. But the VA is strict on their deadline, so we've got to start over, unfortunately.
Okay. Next one here. I developed sleep apnea after service. I believe it's service related. What should I do?
Okay, so sleep apnea at one point in time was almost a give me. I think it was around in the 90s or early 2000s where veterans would file for sleep apnea and they would just easily get it. That has since changed. Now, the question is, there's two ways to get sleep apnea that I've been able to get veterans connect with that without having records of being in the military service. One is Nexus statements, a doctor's letter, buddy statement saying that that I had sleeping issues prior to, or buddy statement saying, hey, he snored a lot. Just basically the statements from people that he knew in service that can vouch for that. The second way I've gotten sleep apnea on there is figuring out what is the cause of a sleep apnea. Is it, night terrors? Is it sinus issues? Is it, allergies? Because a lot of people don't know that if you have like rhinitis or sinusitis and that's already service connected, that is one of the major causes of sleep apnea. So we can always look at the different aspects that what he's already rated and see if any of those can be rated or related to his sleep apnea. So we can file sleep apnea as a secondary issue if one of those conditions that he currently has is a result of sleep apnea.
Okay. Is the process the same if a survivor spouse is trying to get service connected from her husband from the time in service? He passed away from cancer in 2014 and she wants to refile.
Okay, so once a veteran passes, those benefits are gone. It's just if the veteran files for a claim and passes away while that claim is still going, there's what we call an accrued benefit that's still awaiting, which a surviving spouse can collect on. However, if the veteran passes before actually filing that claim, then what would happen is that there's benefits for the widow to look at. If the cancer that he passed from is something from like Agent Orange or something he was service connected for, we would start looking at widows benefits. Because the one of the biggest things that people don't realize is that the VA has benefits not only just for the veterans, but surviving spouses and children even. So if the veteran's passing was due to his service, then there'd be a completely different application process, which a veteran service officer or any VA advocate can assist her in applying for those benefits that or be for her. Now for survivor benefits, we have a pension and we have one called DIC, which is Dependent Intermittent Compensation. The pension is like an as-need based pension, which it's basically derived of what her net income and net worth are, and the veteran has to have served in a time of war to be eligible for. The other one is the DIC is if a veteran does pass due to a service-related injury or disease or anything like that, or the veteran is 100% total and permanent for over 10 years, then the widow can apply for this DIC, which is a set amount of money that she will start getting monthly. I think the going rate right now for DIC widow applicants is about $1,200 or $1,300 a month, but that also opens the avenue to other benefits that she would be entitled to. So any VSO that is assisting this widow, first off, my condolences on the loss. Definitely for them to look at and figure out what they can do for that.
Thank you. Can someone speak to the VA Caregiver Program?
All right. So the VA Caregiver Program, I think it was passed January of this year, or if it wasn't, it was passed last year, where now it's open for any veterans, for family members, spouses that are actually caring for the veterans. I want to say the veterans disability rating has to be 50 or 70% or higher, where they would need a person to come in to help care for them. So instead of filing for like aid and attendance for someone to come in, so it's basically made for like a spouse that has to, stop her job or has to work part-time to help care for that veteran. She can apply for the caregiver program, and basically she'll start getting payments to help care for the veteran and tend to his needs, because there's a lot of veterans that, you know, don't like outside people come to their homes. You know, they trust their wives better, so they rather have their wives take care of them than having some stranger come into the house. So the Caregiver Program has really opened the door, has been opened the door. Used to be just for 9/11 vets. Now it's open, I think, all the way down to, I think it's for all veterans now. That as long as the veteran has a certain disability rating and has certain needs, by all means, the spouse can always apply for that. The best way to do it is to, again, reach out to your local VSO, talk to that, and they can kind of give you the steps. There's like a little cheat sheet you can look at, kind of talks about it. But in short terms, it's a way for basically family members to get a little bit of money to help care for the veteran.
My VA medical records say I was injured in service, but the VA denied my claim. Why isn't that good enough?
That's where I would go into why did they deny it. Now, when you get a letter from the VA, it's a big old packet, but there's two sections there. One is the notification letter. The second one, that's more towards the back, called a VA ratings decision letter. Within the VA ratings decision letter, it will write down exactly what evidence they sought, what evidence they looked at, and the reasoning why they denied it. So to kind of answer your question without actually answering it, I would look at why the VA denied it. Now, 90% of the time, I get veterans that were denied that simply because they didn't have a current disability rating for that. Now, as Martin said, it could also have been that the VA may have overlooked his records. So what I would do is just pull that up, see why they denied it, and then if you have that information, or if you have that information where you can overturn it, obviously you can file a supplemental claim and get that thing overturned.
I've seen, and I'll follow up with Josh, what Josh said, because I see that sometimes when I'm looking through medical records, but the veteran will say, well, I told my VA doctor. When I look at the VA medical records from their treatment at the VA, that's why they're VA medical records. The doctor will often write down there that the subject says he was injured in service, or the doctor will say injured in service, and it comes from the interview that the doctor had with that veteran. He's not, and so that doctor's statement and the veteran's statement to the doctor isn't evidence of the actual injury. And I see that quite frequently, things in the doctor's record that talk about the injury, that says that he was injured. They don't often they don't quote the veteran. They don't say the veteran told me. They will just write it in there, veteran was injured in service, or veteran injured his knee in service. But the doctor is taking that from, it's like hearsay or secondhand. He's taking it from the veteran. And that's just not evidence of an in-service injury unless we have the documentation from service to support it, if that may be the incidence in this question.
I was just going to add a couple of ideas of where to find those support for an injury that occurred in service. Awards and the narratives that go with them are often very helpful. Orders that put you in a place. And this can be important, especially as we go forward with burn pit. So air quality that was done during a deployment at a FOB. So you need orders that put you at that FOB. Also, pre-deployment and post-deployment physicals are helpful. Sick slips, quarter slips, all of those things can help us kind of find that mechanism of injury. Thanks.
Thank you. Next question. I'm in the reserves. I have a service-related medical condition. Can I apply for VA benefits as a veteran?
Okay, so quick answer, yes. I think I mentioned this earlier, is that if you're National Guard, Reserve, you can't get paid drilling and VA at the same time. So a couple things you can do if you want to file for your VA claim, by all means go for it. Just know that there's going to be an offset where you can, there's a couple of ways to go about it, where if you make enough money from your VA pay that you don't want drill pay, you can file some paperwork with your command and the VA saying that, yes, I am drilling, but I'm only wanting VA pay and not drill pay. The other part is that you just notify the VA every time you drill. So what they'll do, they'll basically, they'll pay you up for that month. They can stop your payment whenever you drill, and then when you come back from drill, they can restart that clock for your payment. The third part of it is that the VA has access to like the military database for people that do drill that are receiving compensation. So if you go the whole year with a VA disability rating, the VA will, add up your drill dates and basically send you a letter saying, hey, we are tracking that you drill for this many drill hours, and we are going to reduce your pay for that. So what they'll do, they'll just basically say, hey, we're going to take this much money from you for your drill. And what they'll do, they'll just reduce your payments until that's paid back. So if you're in the reserves or National Guard and you have that disability rating, yes, you can apply and get that VA payment and get that on your record. So quick answer, yes.
Kind of wrapping up here. I got at least one more question from the. Do you need to be in active mental health treatment to file an appeal or new claim for mental health issues?
So if you're filing an appeal, when you file an appeal, essentially you're sending more information that they didn't have previously, if it's not a fully developed claim when you initially did it. So if you're appealing a decision now, if you have a bad rating and everything is there, then by all means, you can file a high-level appeal saying that, or a high-level review saying that, hey, you have all the evidence, I just want someone else to look at it to approve it. But my recommendation is, I always tell someone that, hey, if you get denied for PTSD because they're showing that you don't have that current disability, or you have the signs or indications of PTSD, I would always recommend to reach out to your VA community care to talk to psychologists or road home programs or whoever's in the area, just to annotate that, because the VA doesn't go off of facts and evidence. Now, if you don't provide those facts or evidence, they have nothing else to base it on other than, what the veteran says. Now, not that we're saying that, not all veterans are truthful, or not all veterans, that all veterans lie, but the VA is not going to issue or give a rating based on, how the veteran feels or what they want. So to really get that in there, I would strongly suggest that you get a letter or a diagnosis of something of a psychologist or a mental health expert to add that into your file when you do refile for it.
And there's a follow-up question to that. Does it matter if it's at the VA or with a community-based provider?
No, it does not. It does not matter. The reason why a lot of people do go to the VA is because when the VA pulls records for this claim, if it's within the VA can reach into the VA clinics and basically just pull whatever they want, what they need for that claim. The issue is whenever we go to like outside providers, like road homes, we have to file it's basically a disclosure to release information to the VA. I think I kind of missed this subject whenever I was briefing earlier. That would knock it from a fully developed claim to a standard claim. So a standard claim, if we send a form saying, hey, I'm giving the VA permission to reach out to Dr. Johnson's office to pull these records, it slows it down a little bit. But if that veteran can get those private records in hand and file it with the claim, we can go back to fully developed claim. But to make it simple, you can go to any, as long as they are, accredited, as long as they're licensed doctors or psychologists, they can definitely go through them and get the treatment and the diagnoses if need be.
Okay, thank you. I just wanted to open up to the guest speakers. Is any last things you want to say or leave the audience with before we close out? Okay, well, we appreciate your time. In closing, I would like to thank again, the keynote speakers for sharing their knowledge and wisdom with us, and all the participants who attended the webinar today. As a reminder, a recording of the webinar will be shared through the Road Home Program social media platforms and emailed to anyone who signed up for the event. And with that, we wish you all well and a goodbye. Thank you.